Thank you very much. I think there is nothing new I'm going to talk about. First session has taken care of almost everything that we needed to talk about on prevention, followed by this diabetes talk, which has actually left hardly anything for me to talk about. But all I'm going to say, my message will be very clear. And there is one message, that is nutrition. We have to replace the term of going on diet with something called nutrition. और रशीद साहब ने भी यूज़ किया था परहेज़ इलाज से बेहतर है. I'm running a campaign to get rid of this word parhez because we need to talk about maintaining nutrition. And over the years, what I have seen, that more people die of malnutrition following a bypass surgery or an angioplasty rather than badparezi. The reason is very simple, very common observation. Most of you must have seen, following a cabbage or an angioplasty, people develop postural hypotension, they cannot walk, और एक बड़ा issue होता है डॉक्टर साहब भूख की दवाई दें, ये भूख नहीं लगती. Now, what is the reason? And looking into the reason is that the diet they are provided with is totally unpalatable, and even normal people cannot tolerate that diet. Sadly, it starts from hospital diets. Hospital diets are bad diets. They lack nutrition and, in fact, leads to malnutrition. So let's just move on quickly. We have talked about diet a lot, so I'll just insist on the message that I'm going to provide. Hopefully, okay. This is what is the objective of the whole talk. Won't go into the detail of that because the clock is ticking and I don't want to overdo with that. Okay, it's class 1 indication for most of that. Can you see that? Okay, I'll have to look here. Won't go into detail of that again. Okay, here evidence-based diet guidance to promote cardiovascular health. This is from AHA, and this is adjust energy intake and expenditure. That is, you need to maintain weight, you need to maintain nutrition, and you need to maintain healthy diet. Okay, eat plenty of fruits and vegetables. ये कोई नहीं कहता कि ज़्यादा क्या खाना है. हम सब ये बताते हैं ये बंद कर दो, वो बंद कर दो, वो बंद कर दो, you know. Or sadly, family is very happy because they want to know about parez. And they think कि खाना बंद करने से मर्ज चला जाता है. For God's sake, you've got to make it very clear to them कि खाना बंद करने से मर्ज ने नहीं जाना. And all of you must have heard about this obesity paradox. And there were some studies suggesting that underweights die much earlier as compared to overweight following a cardiac procedure. So moving on, choose healthy sources of protein, mostly proteins from plant, that is legumes, beans, and those things. Fish and seafood is again a healthy form of protein. Low fat or fat free dairy products. दूध का हम समझते हैं कि this is the thing everybody should take. इसके बहुत सारे फायदे होते हैं. Yes, fair enough. It's a great diet for infants because they have nothing else to take. They cannot take anything else. But for adults, this may not be such a good idea. So low fat dairy products is okay rather than full fat. Then if meat and poultry are desired, choose lean cuts, not fatty cuts. So use liquid plant oil rather than, this is again another thing. हमारे यहाँ सबसे common चीज़ है जी बनास्पति घी. I'll come to that. Use liquid oils, plant-based oils, but इसमें भी limitations ये है कि tropical palm oil or coconut oil are not as good. So try and avoid them and advise your patients accordingly. Choose minimally processed foods. Or minimize intake of beverages has been talked about. Sugars, or Europe में तो they are increasing taxes every year on sugary drinks. So choose and prepare food with little or no salt. Here I would advise that no salt is probably not such a good idea because we are used to high salt. Ask them to reduce it. Or हमारे weather में postural hypertension is very common if you use totally avoid the salt. So ask them to reduce it, not to totally cut it. So, and next, of course, now there is very clear suggestion that alcohol in any form even in any quantity, is not so good as we once thought. Okay, body weight, we've talked about, everybody's talking about. So being underweight increases mortality. I've already mentioned being underweight increases mortality rather than decreasing it. So nutritional adequacy is very important. There should be a balance between all forms of diet that we take, that is protein, fats, and carbs. Okay, reducing the risk means reduce low cholesterol, go to low cholesterol diet, but you still are allowed to take at least 7% of your calories from saturated fats, but mostly from polyunsaturated and monosaturated fats. Restriction to cholesterol intake would be maximum of 300, ideally 200 or less. Avoid intake of trans fats. This is the most important part, I think, in this slide. Trans fats are the real killers, and they're mostly present in the partially hydrogenated fats, that is banaspati ghee and margarine. Limit calorie intake from added sugars. This is what has been emphasized. Refined sugars should be taken as the poison of 21st century. So cut down even in healthy people, not just the cardiac patients. So limit post-meal dessert intakes with less than 10% calories from added sugars. Of course, you can continue to take complex carbs. Again, less than 35%, ideally 30% or less of your calories must come from fat. So अगर आप इनको उबला हुआ खाना खिलाते हैं, जैसे most of the people get after a bypass or an angioplasty at home, they think it's very healthy. It is not. You develop malnutrition, so many essential ingredients of food may not be absorbed, the fat-soluble vitamins will not be absorbed. Encourage fat-free or low-salt milk, yogurt and cheese. Again, repeating the same message about dairy products, vegetable oils, and of course, sodium should be restricted to whatever is tolerated. Repeating the same message again and again, because as I said, everything has been said, everything has been repeated again. A simple message, which I will come to. Okay. Right. This, I think, is a very important slide for me. Here, what food should be palatable as per local taste. That means, अगर हम यहाँ रोटी सालन खाते हैं, तो हमें रोटी सालन ही खाना है. So that is what AHA has actually adjusted itself over the last few years. Initially, they just used to talk about their own culture, but now they have become global, and they're advising that it should be as per local taste. And tasteless diet will lead to malnutrition and undue weight loss. And we have known that losing too much weight can be lethal, actually. So cooking separate meal for patient, जो हमारे यहाँ culture है, is never healthy and cannot be sustained for a long period of time. Therefore, the whole family should go for a healthy diet rather than parezi diet. So the whole family has to adjust, because if somebody in the family has got cardiac problem, rest assured, all of them are at risk. So one of the risk factors, that is family history, becomes positive. So they should adjust their diet as per, and again, as I said, parezi khana. We need to adjust ourselves in our thinking that we need to have a healthy diet which is good for your heart and which provides enough calories and nutrition to maintain good health. Some amount of salt is necessary, is needed. Most of the time, our naturally occurring diet has got enough salt, that is good for health, that is enough. But since our taste is bad, which is true for the whole world actually, and I recall PepsiCo CEO delivering a talk, and in his talk he said, okay, whatever we have tried, human tongue wants sodium chloride. So I think cut it down as much as you can. Avoid cardiac cachexia, particularly in heart failure patients, because their appetite is already low, and if you make the diet very poorly tasting, so they are going to die much earlier than expected. Here, some of the slides just to reinforce what I'm saying. It is body mass index as a risk factor for coronary events and mortality in patients. So mortality is associated with underweight. Then underweight is associated with higher mortality and cost for hospitalization and other things. Just to highlight, Okay, this is about chilies. एक concept ये है कि हमारे यहाँ जी मिर्ची बंद कर दो. Now there is some data, in fact, a large study from Italy has come out that people who consume chilies actually have a better survival than those who consume less chilies. So there is a lot of data, I'm just reinforcing it rather than spending time on it. So there is enough data to suggest that chilies are not as bad for the heart, particularly for heart failure, because they are vasodilators. आपको पसीना क्यों आता है मिर्च खा के? Because there is intense vasodilatation. Okay. Rehab following a cardiac event as well as cardiac procedures like cabbage or PCI include both physical and dietary modifications. Diet should be heart healthy yet palatable. I repeat, yet palatable. Restrict saturated fats, high intake of green leafy vegetable. For God's sake, मरीजों को ये बताइए कि ज़्यादा क्या खाना है. So this is very important, which I notice none of us talk about. High intake of fresh fruits. Blend food does not always mean healthy diet. Chilies are to some extent beneficial. Exercise within patient's physical activity. Is pe mera khayal hai I can deliver a talk for more than half an hour. We keep talking about moderate intense exercise, but we do not consider the people who have got knee arthritis, who are old, who are not used to activity. I have a program which I actually advise to my patients how to go about it, because every problem has a solution. Okay, this is another thing. And finally, I think Rashid Saab ne bhi isko slide dali thi. 5th of August ko, Professor Rashid is hosting this NCPC, National Congress of Preventive Cardiology, and we would welcome all of you there. Thank you very much.